good evening everyone, and thanks very much for the invitation to come and speak to you today. So I'm not too disheartened that you haven't heard too much about MindTech as of yet, and as that's the aim of my talk, that's actually quite a good thing, so at least I'm not preached as a converted. We're relatively new, so that's maybe that's not too surprising. So the aim of today is just to give a bit of an overview about what MindTech is, and perhaps for you to understand how you might be able to engage with us and perhaps work with us, certainly for us to be able to learn about what you're doing, and maybe also vice versa as well, learn from some of the work that we're doing as well. So I don't know if you know much about the HTC's Healthcare Technology Cooperatives, but there's 8 of these around the country. We were set up last year. We've probably only been going about sort of 9-10 months properly. We receive NIHR infrastructure funding, and we're quite a small organisation, and NIHR tendered for these about 1.5 years ago based on a pilot which was Devices for Dignity, which is all about assistive technology, and that was a big success, and so they decided that they wanted to do more of these, and these were the ones that got funded, so there may be other ones there that you might want to look into. And the aims of these were to look, they wanted groups that were going to focus on areas where there was high unmet clinical need, where technology had the opportunity to maybe add some value and provide some benefits, but where technology hadn't historically played a big part. And apparently they hadn't thought about doing mental health at all. So when they got the application from the Nottingham group, which is where we're based, it suddenly seemed very obvious, and they funded us. So yeah, we've been funded for 4 years in the first instance, and we receive a relatively, well, a pretty small amount of money, we think, only 200k a year, and it's very much infrastructure funding to try and build capacity within the field. So I don't think I probably need this slide for this audience, but obviously mental health is a huge issue. Why NIHR hadn't thought about this? I mean, I think that the amount of research funded in mental health is very low anyway, so hopefully we're trying to stimulate that. So the focus that we have 3 clinical themes that we're focusing on in the initial stages, and that's because at Nottingham we have particular expertise in that area. So MindTech is a partnership between the Institute of Mental Health in Nottingham and Nottinghamshire NHS Trust. And we also have a partnership with the University of Nottingham, where a lot of our academic partners come from. And so we focused on, initially it was mood disorders and neurodevelopmental disorders for our initial focus, and then a month after we got the funding, they decided that they'd like us to add dementia to our theme as well, as another theme. I think partly because Tom Denning joined the Institute of Mental Health as a professor of dementia research, and I think it was an area that he felt he could bring to the network, but it has inevitably led to a big brief becoming even bigger. So we deal with all aspects of mental health pretty much, and all aspects of technology, whether or not that's from deep brain stimulation to apps. So the first 6 months or so, I guess, has been very much trying to focus on a few areas where we can try and have some sort of an effect and start to do some work with a view to looking for the future for other areas. And so that's what I'm going to be focusing on today, is just introducing some of those, and I've picked the pieces of work that we were doing that I thought would be of most interest to this audience, so things that cut across the health informatics spectrum. So yeah, MindTech, the Healthcare Technology Cooperatives, they're cooperatives, so they're not about doing all the work ourselves, they're about trying to build capacity within the sector and to bring, in a similar way to the AHSNs and other organisations like this, is bringing users, industry, academics and the NHS together to try and speed up the amount of technology being developed, speed up evaluation, speed up implementation, and also speed up the spread of what's good to other areas, and to deal with some of the evidence issues. And that's some of the people that we're working with already, although that's already quite out of date. So I'm just going to cover now a couple of the areas that we're working on. So we're doing quite a lot of work on digital products for mental health. This is something we've been pretty much inundated with, and I think sets us aside from some of the other HTCs who are focusing on the more traditional healthcare technology. My background's in medical devices, and used to dealing with a maybe 10-12 year process from an idea of a project through development, clinical trials, and launch. Whereas now there's, people can have an idea for an app, have it developed within a week and be selling it, and somebody with a mental health condition, or perhaps somebody who thinks they might have a mental health condition, can be using it. And although that's quite exciting in terms of the speed of the way things are happening, it's also quite scary in terms of issues such as safety. So we are focusing, there's sort of two aspects that we're focusing on. One project that we're working on is looking at the apps that are available and marketed direct to the consumer. And starting point for this, we're doing some work with Comic Relief, who funded about 2-3 years ago 7 digital products for young people and mental health and well-being. And I think it's pretty, bearing in mind they did this 3 years ago, I think that was, I would imagine at the time that was very new. And inevitably, there's been a lot of learning from that's gone on about in terms of what people want from these products, what sort of benefit or value they're aiming to provide, and whether or not there's any evidence that they're beneficial. And that's taking away anything to do with in terms of value for money. I think one of the things that we're really struck with in this area is that the market is completely underdeveloped. We are getting, I would say, over 100 developers come to us in the last 6 months saying, I'm developing this app, I'm marketing this app. And the idea that a sustainable business can be built around these sorts of products at the moment is questionable, I would say. The NHS certainly doesn't know how it wants to deal with these sorts of products. I don't think the public understands what they can expect from these. And the fact that there's so many and so much rubbish means that the ones that we're coming across, which are really quite good, that are based on good evidence, they get lost. They get completely lost in the ether. And so that's a big issue. So we're also doing a lot of work with apps for the NHS in collaboration with a number of NHS trusts locally to us in Nottingham, but also up in Yorkshire. I think this project started from a trust that we knew and clinicians that we knew, waiting for some sort of guidance to come from NHS England about what they should do about these and what they should do about safety, information governance, interaction with services, those sorts of things, realising that wasn't going to come anytime soon. So let's just get on, do something, and just learn while we do it. And so we've developed an initial framework to help clinicians or trusts appraise apps, decide whether or not they want to use them, and then to try and, our aim is that we, by understanding what information people need to know, the NHS Apps Library or another organisation that might fill that role can start to set that out to developers, so we can sort of raise the bar and help good products stand out and help users differentiate the two. And we're working in collaboration with NHS England and the people involved with the App Store on that project. Another issue that we're doing a lot with is the whole issue of remote video calling for delivering evidence-based therapies in mental health. And we're working quite closely with Notts Healthcare Trust, who are wanting to take on technology in this area. And we're also working with the Clark in the East Midlands, who are doing 2 large-scale clinical trials around self-harm and health anxiety and the role of physio therapy in this. And I think what we've been struck with even last year is the amount of new technologies that have suddenly come on the market. The market suddenly seems to be understanding this area, and the functionality is increasing rapidly. And we're working with our local AHSN in the East Midlands to look at, again, what's on the market, what the features are that people need, to try and develop a protocol whereby people who want to take on this can decide their requirements for themselves, work through issues like usability, risk, security, interoperability, all those issues, to try and make a good decision, as best decision as they can at the time, that meets their needs. The Clark came to us and said, we want to use we've got a 4-year clinical trial, what system should we use? And they wanted us to come up with something, and we said, no, we're not going to make that decision for you. But we just tried to help them make the best decision based on the information at the time that they can then justify in 4 to 5 years' time when they're writing up that study, bearing in mind that the landscape will look completely different at that time, and that their results they want to write up so that they aren't linked inextricably to that technology, which might be completely obsolete by that time. So, bearing in mind the theme of today was dementia, I asked Tom Denny, who leads our dementia theme, just to give me a couple of slides about the sort of work that he wants to do in MindTech, bearing in mind that he is aware that we're a very small organisation and that it's a very small part of the national picture in terms of dementia research. And so his interests is, I'm preaching to the converted here again on that slide. But his interests are very much around needs and aspirations, and moving away from the traditional focus in terms of basic care needs, in terms of activities of daily life and safety and risk and keeping people safe, to more aspirational technologies in terms of how you can help people do the things that matter to them, that make life worth living, maintaining hobbies, social connections, all that kind of stuff. And the whole issue of reaching their higher goals. And he believes that this is very much linked to the market. You know, the market at the moment is very much, it's already quite developed, but it's very much product-led. It's very much products that are being sold, from what I understand, direct to consumers. The evidence in terms of whether or not that's something to do with clinical evidence isn't quite there. But there needs to be a much more of a consideration of services around products, and whether or not we can encourage industry in particular to move in and provide attractive services that people can take up at various different times of their lives, and equity of access being a huge area. And so he just asked me to introduce one small project that the dementia theme on MindTech is probably the least developed, and we're looking for more interesting things to do. But this project has been going about 6 months now, and it was funded as part of the TSB's Long-Term Revolution Sandpit competition that went on last year. And this is an industry-led project by a service provider, working with Tom and some of the MindTech team in Nottingham, but also a couple of other universities as well. And it's all about designing packages of products. It's got a sort of fairly short to medium term goal in terms of not looking at 20 years and what's possible, what can we deliver in the next 5 to 8 years with the technology that we have at the moment. There's plenty of technology out there that could be appropriated in different ways to provide services, and with the aims of independent living, but also maintaining enjoyable things as part of that. That's a slide that he's given me, which is, I think, is the model for CASA, which is the idea of taking devices and products that are available at the moment and trying to see how they can be packaged together in a way that meets the needs of people with dementia and the people that care for them, and to provide solutions, and then a testing of those sort of solutions with regard to things, aspirations. So, and the idea is that maybe there's packages in a way that I think the model, the way that he describes it often is that in the same way as Virgin or Sky or whoever have packages of services which you can take on and drop as your situations or your preferences change. So, for example, if cooking for people is important to you, then they can do things around that, but then maybe as your capabilities maybe decrease slightly, then other things can come in to support things in other ways. And the academic partners and the engineers in particular are looking at ways of sensing how how people's requirements and needs are changing based on how they're using the technology in their home. So that's all quite interesting, but it's still quite new, that project. So I'm just going to leave it there. So this is just we're in Nottingham. We're very keen to hear what people are doing elsewhere, and to try and bring the expertise that we have to hopefully help in any way that we can, but also to take on really interesting pilots. And I've already just heard about one that I'm going to go back and talk about now, and see how we can disseminate that perhaps locally. So I'll just leave with a bit of a plug. One of the big things that's come out of our last year or so is just the fact that evidence in this issue, in this topic, is such a interesting one in terms of how you measure the benefit of these. Is the traditional NHS model the right one? A lot of the products that we're dealing with don't interact or may not interact with NHS services at all. for example, we're doing an evaluation of the Big White Wall online community on mental health, and that might be used, or it could potentially be used, and people could get a lot of benefit who don't have a diagnosis, perhaps, or have a diagnosis but haven't been offered appropriate treatment. So we had a conference last year which was a big success, and we're running another one this year which is focusing particularly on evidence. And just, I guess, as a hook, we've just written a chapter on technology and mental health for the Chief Medical Officer's report, which this year is the focus is on mental health. And last year the focus of that report was young people and long-term conditions, and that's this year's focus of NIHR and their main funding calls. So we're hoping, and we're trying to start the rumour that next year it means it's going to be mental health. So this is very much trying to build people, bring people together to try and ask the big questions about what big research projects should be trying to address, and trying to develop the partnerships that might be able to go for those. So I'll just leave that there and say, look at our website, follow us on Twitter. That's probably our best way of getting little snippets out to people, and come and have a chat, or send me an email, and I'd like to meet them.
Thank you.
Thanks.